Hello, everybody. I'm Chelsea King, and I am the Executive Director of the Oregon Health and Education Collaborative. And I am happy to be here today with Kim Scott, who is an outgoing board member of OHEC. And many of you who are watching this probably already know Kim Scott and don't need me to introduce him. But for anybody who is learning of him for the first time, he spent many years, I believe decades, as the CEO of Trillium Family Services, which is Oregon's leading provider of mental and behavioral health care for children and families. And he just has a lot to offer in the way of building community resilience. And I'm really thankful to have you here with me, Kim.
Oh, it's great being here with you, Chelsea. I appreciate the opportunity to get to join you here from the beautiful Long Beach Peninsula, starting my retirement after all those years of working with Trillium. So thank you for the opportunity. I really appreciate it.
Yeah, you bet. How nice to, on a Monday morning, just be out at the beach instead of in an office somewhere. So glad that you get to do that. Yeah. So, Kim, I want to start with a question that's just been on everybody's mind and in the press and just all over the place for at least 2 or 3 years, definitely since COVID-19 pandemic and before. And that is this idea of, the state of mental and behavioral health with our youth. And
Yeah.
so I'm curious from your perspective, you spent a career dedicated to this topic. What's your assessment of the current state of our young folks' mental behavioral health?
Yeah, I think it's an interesting time in the sense that I think our young people and families and communities need support and need us more than ever in a lot of ways. I just look at it and think about just from a trauma perspective that one of the things with the pandemic is I think that it drove home the sense that trauma is a story about all of us. That one of the things I think that we began to understand through the pandemic is that trauma and mental health and wellness is not just about any certain people or certain groups. It's really a story about all of us. And I just, for our kids and families, I think, even aside from, the personal traumas that people experience, or, how traumatic things like, a pandemic has been, just the general stress of modern life, I think, is really hard for young people, for families to navigate. And I'm not sure that from a program and service perspective, that the way that we have historically organized ourselves in terms of supporting people, is the best way to do that in the future. And so when I look at all of this, I think about, where are some opportunities? The one of the opportunities being it's more of a universal sense that we have things to work on as again, individuals, families, and communities. But also on this moment, is there an opportunity to rethink the way that we do things and to get a different alignment in a way that better supports all communities in this moment? And I think there's more of a willingness, I would say a passion to do that, from I think all components of the ecosystem, from the payers and the state and the providers and the communities, kids and families themselves. I think there's a willingness to think about health and wellness in different ways and to identify the supports that will work best moving forward.
Yeah, one of the things that I learned about you right away when I first started to get to know you is this knowledge you have about appreciative inquiry. And I do believe even you gave me a book titled What's Going Well, if I'm recalling that correctly.
Yeah.
And so I hear you talking about this willingness to think about how to do things differently. And what I hear when I listen to that is this idea of systems level change, right? We're not looking to necessarily create new programs so much as look at different ways that we are integrating what we do. Can you
Yeah.
weave together what you're saying with this idea of appreciative inquiry and
Yeah. No, I think the answers kind of lie in that ecosystem approach. And unfortunately, the way that we've organized historically, probably because of payer systems and how the flow of funds happens for certain discrete services or narrowly defined services, silos, it really has kept us in a lot of ways from looking at this as an entire ecosystem and how all parts of that ecosystem, there are strengths, and how do we build on those strengths? How do we work better together, collaboratively? Prish of Inquiry really talks to us about, discovering strengths. What gives us life. So you go through this process of discovering and dreaming that idea of what could we do, designing what should we do, and then destiny, what will we do? And I think those are the kinds of things in an ecosystem approach where all of the connected parties that are part of that ecosystem, the opportunity to work together through those things that, what really does give us life, what are strengths that we can build on, particularly in this moment. That seems like a foundational starting point to me.
Yeah, thank you for articulating that. The idea of funding streams being part of what created the silos, and
Yeah.
perhaps even just this shift in consciousness that we've had as we progress as humans into understanding our interdependence, and that the answer would lie in that as well.
And I think leadership in moments like this, and I'm not talking positional leadership, but leadership, from everybody as we're looking at the situation. I think like the thing that really drew me to the Oregon Health Education Roundtable and now Collaborative was this idea of confluence thinking, this idea of, as a state and probably as a nation, we invest a lot in education and mental health or health and wellness, but we see those as separate mandates. And so that idea of bringing these two powerful rivers together in terms of confluence thinking and thinking about how do we break down silos and work in ways that best support kids, families, and communities within these natural settings of their families, their communities, and their schools.
Yeah, thank you. I want to ask you a little bit, return to this idea of what drew you to OHEC, but there's something that you've said a couple times that I want to dig in on a little bit, which is this idea of not just individual experience of trauma or individual experience of resilience, but the idea of it being embedded in a community, and that there can be community trauma or community resilience. So I'm curious, most folks probably who are watching this know about the pair of ACEs, but can you tell us a little bit about what is the pair of ACEs, and then what do you know about building resilience individually and communally?
Yeah. So the pair of aces, if you picture the first ace being, a tree and all the branches and things, and that kind of represents, I think, those kind of individual kinds of traumas that we all experience in terms of those adverse childhood experiences, everything from neglect, abuse, etc. But the second ace really is the roots. What are the roots to the tree, the soil? And many of our communities are faced with, not on their own doing, but kind of a toxicity in the community because of lack of access, lack of support, those historical policies that haven't best supported all communities. And so that's why this concept of, you've heard so many people talk about one of the best indicators of your health is your zip code. Where you live matters. And I think that's just directly relatable to, how we invested in those communities, how we supported them, what kind of equity is there. So those are all things in that pair of aces that make me think about how do we get through this and how do we create resilience. When I think about that, I really do borrow a lot of my thinking from Sandy Bloom and other trauma theorists that they talk about the need for us to, as human beings, as it relates to trauma and as it relates to our experience, is the need for safety. And the way that they frame it is that there's kind of 5 domains of safety, and it's certainly your physical, your social, moral, but cultural safety. emotional safety, all of those things. Human beings, to be able to thrive, need to feel safe in those kinds of in those domains. And if I look at this, so many of our communities are suffering because they don't have that sense of safety in these really disruptive times. And probably historically, for some communities, that sense of safety and well-being hasn't been there because, again, the lack of investment, the lack of policies that best support all communities.
I find that so poignant right now, even as I picture you walking out on the beach under a beautiful blue sky. And I think about historically and still today, the folks who don't feel safe walking through open nature. So, even just access to something like that, which we know is so good for our well being, is not accessible to everyone because
Right.
of safety. Hmm.
Yeah. Well,
Yeah.
I think, again, going back to what are some of the opportunities, the thing that again, drew me to OHEC is one, this idea, this confluence thinking and, the kind of the eradication of silos and stuff. But I think the other thing is this is a time to partner, to collaborate, to build capacity through collaborations. This is not a go it alone time. And yet, so many of our not-for-profits, we're individual organizations with individual boards. We're viewed as individual businesses. And sometimes our focus on are we being successful or not is kind of it's almost contingent on, how well are we delivering a particular service, a historical program that we provided. And really, maybe one of the measures that hasn't been in place and it has to be in the future is, are those programs and services even relevant anymore in terms of what communities and families need? So again, an opportunity during this time is, how do we build um, capacity, resources through collaboration, new learnings and ways that are relevant to all communities? And I don't think that that means that we're necessarily partnering with like agencies or like programs and services. And there's that kind of, I would say, directional learning. You certainly grow that way. But I think it's a time for, looking at intersections. So what is the intersection with things like, care and technology and, new learnings and ways that help us grow? And I think that's part of the potential of these community designed solutions that you folks are looking at through OHEC. I think that's where some of the possibilities lie in terms of developing a system that actually best supports children, families, and communities.
Yeah, what I'm resonating with there is this idea also of breaking down the competitive or arrogant or ego-driven kind of ways that some of our organizations have had to operate to survive the system that we're operating in. And so, by the very nature of collaboration, it means we do have a fair amount of humility and open-mindedness and willingness to give and receive, and all those principles have to be in place.
Yeah. Yeah, I think the days of just looking kind of within the context of an organization or an entity, um, I think those days have to end. And it's good that they are ending because I think you have to look at the organization or the entity within the context of a sector, a system, a community, society, and then, what's possible in terms of what we're trying to grow together. So I think that contextual work is really, really important. And again, this isn't a time to go it alone and to kind of invest in what we've always done. How do we invest and build capacity and learning and doing things that truly are relevant to communities?
Yeah. Oh, I hope I can achieve that. I hope we at OHEC can achieve that.
Well,
It definitely will take it takes time, right? We're in this great fertile kind of transition out of, the impact of COVID-19. And, I think folks are asking this question and leaning into it more than ever before.
I think there's this piece around, we've talked about, silos and systems and ecosystem. I mentioned earlier that idea about, I think that leaders and how leaders view this work, and again, not positional leaders, but how people envision this work and how they want to show up to do the work. I also wonder about the opportunity of moving from a very prescriptive kind of a lens when we're providing services. Sometimes there's this uh, uh, historically there's been a very strong prescriptive sense of kind of telling people what they should do in a lot of ways. And what I'm wondering about in this new world is more of a model of connection and accompaniment. This idea of, in one way or another, all of us are on a journey of health and well-being. And so instead of this kind of positional authority that comes with being a provider or a caretaker, that idea of, hey, we're all working on this together. Let's work shoulder to shoulder on this kind of journey of health and wellness. To me, it's about connection, but it's also about inviting people to be part of something. And I think that's been missing when you have a very siloed prescriptive approach, which is what we've had.
Yeah, I'm hearing like those fundamental human needs of connection and belonging, really being at the center of a new way of being with one another in the business or nonprofit or service delivery model. And also, I've been thinking a lot about just in my life, the decreasing the performative nature of so much of what has happened in politics and business and in our nation, and really getting authentic.
Yeah,
I believe from being around young people that is one of the things that the youth are really delivering to our culture right now is a real
agreed.
readiness and thirst for authenticity and no more tolerance of per- performance.
Yeah. Yeah. Well, when you think about an appreciative lens, that's what gets me excited too. I think the young people that are moving into this field, into this work, this is almost like second nature to them. This is something I think that is going to continue to grow, and that gives me a lot of hope for the future.
Yeah, thanks. Me too. So I have one final question. I'm wondering if you could speak to the Upstream initiative. And just by way of introducing it for anybody who's watching this that doesn't know about it, this is OHEC's flagship effort. It won't be our only effort, but it's really what we're leading with right now. And it's the whole idea of that everything we've been talking about with that cross-sector collaboration and the community resilience and addressing ACEs and doing all of this with a really targeted focus on that first 1,000 days of life, prenatal to age 2 or 3. And I'm wondering if you can address what you know to be true about that formative stage of the new human, but also of the family, and just speak to
Yeah.
why would Upstream initiative be important right now?
Gosh, in my own life, I'm thinking back when, our first kid and my wife and I had both worked in the field, and along comes our little baby daughter. And I just realized, gosh, I had to take training and all this to be able to drive a car and all those kinds of things. But being a parent, all of a sudden, you're just kind of, you're forced into this role. I mean, you obviously want to be in this role, but in terms of like prior skills, experience, training, etc., supports there's not a lot there. And then if I think about the bulk of my career, it's really working with systems and families and individuals where those supports weren't in place, and that over time, trauma on top of trauma or whatever's happening in people's lives, it's more than they can bear. And by then so much of the of damage has already occurred. And I think, certainly people are resilient, and we've had, outcomes. There's all kinds of possibilities for how people work through those issues. But what would it mean for us from the very beginning to connect with a young family and to help provide kind of that support? Making sure that everybody is healthy and that they're getting the attention that they deserve, they need to be successful, and focusing on that and learning more about, what are the best supports in that kind of environment. And I can't help but think that if we focus so much more on that, we would see less and less of really my 45-year career of intervening in a process that's pretty far down the path. I think that if we get to that earlier, in ways that it's not an intervention as much as it is that human beings need connection, they need support systems, and how do we kind of build that kind of a service fabric? We certainly have the other, Now let's really focus on building this in ways that support kids in natural settings like their homes, their communities, and their schools, and in supporting families as well.
I love the metaphor of the service fabric and it living, in the neighborhood and in the schools and in the communities. That's a very nice image. Yeah. Well, I would love to get you back on your way of walking along that beautiful coastline. And I'm wondering if you just have any final words or anything else you want to highlight or say that I didn't ask about.
Yeah, well, I a couple things. One, what a great opportunity in my last couple of years of my career to get to be part of the founding group that really started looking at this Oregon Health Education Roundtable, now collaborative. It's been really exciting work. And Chelsea, to you, I have to say that work in the last year got even more focus. And I think you, as a leader in this role, are doing an incredible job, will continue doing an incredible job. I'm just really excited to see these community solutions with the funding and support that really starts to get us aligned on these ecosystem kinds of solutions. I think OHEC can be the flagship of those kinds of pilots that can grow that service fabric that we talked about earlier.
Yeah, and what I have to say to that is may it be so. And that is definitely my shared hope. And I appreciate what you and the other folks who were at that round table did to get this started. And I appreciate your service on the board and the work you did to help us find replacements on the board. And just wish you a lot of joy. And I know our paths are going to continue to cross.
Absolutely, they will. Thank you, Chelsea. I so
Yeah.
appreciate it.